Good afternoon. Thank you so much for joining us today. I'm Dr. Tracy Yeager and will serve as the moderator for today's discussion. I'm the president of Portage Path Behavioral Health, which has been guiding people along the path to recovery from mental illness and substance abuse for nearly 50 years. Today we've brought together, a great panel of local mental health experts and advocates to discuss suicide awareness and prevention. Our goal today for everyone joining us is that you'll come away with some useful information about suicide prevention, suicide awareness, perhaps the warning signs, ideas of what to say to someone who may be in need, how to locate some resources here in Summit County, anything that could help you save a life. Our panel presentation today is part of our annual KJ's 5K for mental health and animal rescue. This year, of course, our 5K has to be virtual. We'd like to thank Sherry Kennedy, who is one of our panelists here today, for helping us create KJ's 5K. About 4 years ago, we had our first one. We'd also like to thank our major event sponsors, whose logos you will see on posters during our discussion today. First, our registration sponsor is Genoa Healthcare. Our starting line sponsor, One Digital Benefits. Our finish line sponsor, the County of Summit Alcohol, Drug Addiction, and Mental Health Services Board. Our premier sponsor of Cleveland Clinic Akron General. And last but not least, and best, our presenting sponsor this year is Cleveland Electrical Laboratories. Again, I would like to express gratitude to all of our sponsors for their support. I'd like to introduce now Dr. Alan Seymour, who's the president of Cleveland Electric Laboratories and our presenting sponsor, to say a few words before we begin our panel discussion. Dr. Seymour?
Thank you. Honored to be here. Cleveland Electric Labs is honored to be part of Portage Path. Does for our communities, mental health in Ohio. CL is a 100-year-old company. We began our journey making sensors for the heat industry. We specialize in temperatures over 1,000 degrees, and it's still our core business today. We also make fiber optics sensors for security, leak detection, and structural health monitoring. Our thermocouple sensors are utilized in about every aspect of life, from aerospace to the medical fields, where our thermocouples test turbine engines and help make prosthetics. Our fiber optic sensors are used to monitor bridges for any structural issues, deformities, as the Brooklyn Bridge we have our sensors on. And we also will monitor what's called usually deemed high-value government institutions for intrusion detection. But more importantly, and why we're excited to get involved than any product or accomplishments in business, are the people that you have. As a family-owned business, we are thrilled to be supporting Portage Path Behavioral Health, because we always look to our employees as family, and would break our hearts to lose anyone to suicide. This is why Jack Liskey, the CEO, and myself are excited to have Cleveland Electric Labs sponsor the work you are trying to accomplish in the mental health industry. Because without mentally and emotionally healthy employees, thus we would not be where we are today. The topic, to me, could not be more prevalent. Having a background in clinical counseling, I have dealt with this issue firsthand with patients, and I've also lost a friend to suicide. But I can't remember a time where suicide seems to be as bad as it is today. A new special came out on Netflix, which maybe you think about this event today. It was called The Social Dilemma. And it talks about some social media came out in full cycle. Suicide among middle-aged students has gone up over 100%. And over 70% for high school age students. They didn't even get into the adults at that point. Now, taking into account quarantine from COVID and the anxieties and issues that's added to social media anxieties with all ages, I think we're seeing a pandemic almost of suicide that many of our society aren't even aware of. This being a reason why we are so grateful and excited to support Portage Path Behavioral Health and everything you are doing to bring the issue and problem of suicide to light. Thank you for allowing us just to be a small part.
Thank you, Alan. I appreciate those comments, and we truly appreciate your support. As a token of our appreciation, we would like to present you with the very first numbered race bib for this year's 5K. So CEL is going to be 100.
Awesome.
Thank you very, very much.
Matches our 100-year anniversary.
There you go. Well, how perfect is that? We didn't even know.
That's right.
Okay, so we're just very honored to be able to have you here. Again, your thoughts, very timely. We couldn't agree more. We're going to take a few minutes now for each of the panelists to briefly introduce themselves and tell a little bit about their background. Then we'll begin our conversation. We're hoping to save some time at the end for some questions from the audience. If you don't have any questions that are answered, or if your questions are answered during our presentation, you can submit them in the comments section and we'll get to those at the very end. So maybe we'll start with Sherry.
I'm Sherry Kennedy. I have been a suicide advocate since 2016, and I'm KJ's mother.
Hi, good afternoon. My name is Matt Esky. Well, first off, I'd like to thank Portage Path, Dr. Yeager, and Summit County ADM Board for having me here today. This is an honor to be asked to participate in such a great program. So thank you very much for having me. Appreciate it.
Absolutely.
My name is Matt Eskia. I work for the City of Akron Fire Department. I'm a lieutenant at Station 14, which is over in the Goodyear Heights neighborhood, if anybody's familiar with that area. I've been on the fire department for about 15 and a half years, and prior to my career as a firefighter and paramedic, I worked as a counselor and a social worker at Community Support Services for about 7 years. I'm also a licensed professional counselor, and I coordinate the City of Akron Fire Department's peer support and critical incident stress management team. In addition to that, I am the Ohio Association of Professional Firefighters peer support team clinical coordinator. That program has been in existence now. It'll be about 3 years. So we have firefighters across the state of Ohio who are trained in providing emotional support to other first responders, especially after critical incidents or traumatic events. I'm also a crisis intervention team member. I've been on that team for about 7 or 8 years in the city of Akron. So that's a little bit about me. I live here in Akron with my wife and my 16-and-a-half-year-old daughter.
Matt, I think you need some more responsibilities with your job. Clearly, I think that's how we all tend to lead. I think it's really interesting and great to, and we're going to hear from Jerry. We have people with clinical background in this type of work. They're here today sharing their thoughts, and that means Jerry's going to say something similar. Go ahead.
Yes, well, good afternoon, and thank you, Tracy, for inviting me to be a participant in this. My name is Jerry Craig, and I'm with the Summit County Alcohol, Drug Addiction, and Mental Health Services Board, otherwise known as the ADM Board. And our role in the community is to really assess community needs as it relates to issues around mental health and addiction treatment, prevention, and supports. And what we do is we fund agencies to provide those services in order to meet the needs of the community, to make it a healthier community. I've been with the ADM Board for 13 years, and before at the ADM Board, actually Matt and I worked together at Community Support Services, and I spent 19 years there working with people with serious mental illnesses.
Again, great background. Sharon?
Thank you. I too am honored to be here today and express my thanks and gratitude. I'm Sharon Guskin. I'm happily retired after 30 years at Summit County Children's Services. I am a past and present volunteer on our Summit County Crisis Hotline. I also co-facilitate the Survivors Group here in Summit County. On a personal note, I lost a dear lady to suicide many years ago, and that's a pain you never ever forget. I've also had people very close to me attempt suicide and thankfully get help and move on into productive life. So suicide prevention will always be very near and dear to my heart.
I am grateful for this panel. As you can hear from their introductions and their background, varied people from all different places coming together today to support us and support the community in this work. So I cannot thank you all enough. Let's start with some questions. This one we're going to start with for Jerry. Summit County, unfortunately, our suicide rate right now is among the highest in Ohio. What are we doing in Summit County to reduce this rate?
So the Summit County ADM Board, while we don't provide any direct services, we really are the hub to help support the provision of services and supports throughout the community for whatever issue is around. We want to support the Suicide Prevention Coalition efforts, and so we are the sort of the coordinating entity for that. But this is really a coalition that's run by people in the community who are interested in this matter. We stand on the shoulders of giants. You know, Andy Denton who had the role of the coordinator of the Suicide Prevention Coalition, along with Barb Medlock, who also recently retired from Portage Path Behavioral Health, have played an instrumental role in supporting the efforts to get people to understand the signs and symptoms of suicide, but also to support people who've been victims of suicide, whether it be as a family member or a friend. The focus of the ADM board and the Suicide Prevention Coalition has really been around child and adolescent prevention approaches. This is one of our most significant new endeavors, and this is because of a grant that we got through Akron Children's Hospital. The grant that the Akron Children's Hospital received allowed us to do some planning and to put together a plan to address suicide among young people. And I think that's something that's really important, especially right now, because young people are particularly susceptible, as Alan said earlier. We're also currently restructuring into subgroups, and the subgroups are to tackle more areas simultaneously. So we have an adult suicide focus, but we also have a focus on kids. We also have a relationship with our faith-based community. Our Suicide Prevention Coalition works very closely with and has membership that sort of cross members with our Change Direction faith-based community. We know that it's important for us to link to people who are involved in the faith-based program, either as congregants or participants, but also with the clergy, to help them to identify help resources for their parishioners who might need assistance. We want to build in supports to schools, to businesses, and through social media, and that's why we are pushing through the Suicide Prevention Coalition the opportunity for individuals to participate in the QPR training, to question, persuade, and respond, so that we can identify people who might be struggling and we can get them the help resources that they most need. Finally, I'd like to talk a little bit about the Zero Suicide Initiative. Several years ago, the ADM board brought Dr. Hogan in to talk with us about zero suicide. One of the things that we discovered is that contact with primary care providers in the time leading up to suicide is very common. And while 3 of 4 suicide victims had contact with primary care providers within the past year of suicide, approximately 1/3 of the suicide victims had contact with mental health services. So the Zero Suicide Initiative involves a toolkit that starts off with things as simple as carrying contacts. We're reaching out to individuals after having seen a medical provider to see how they're doing, to follow up with them. And I don't know any of you who've had a contact from your primary care provider, but it feels good to have somebody, to know that they care about you, that you're not more than just an appointment for them. And I think that the best thing that we can do, and probably the most effective thing we can do, is really make that physical contact or connection with people in order to let them know that you care. And that's really what the Zero Suicide program is all about. It's about helping us to be a little bit more intentional about how we work with folks who touch our systems.
Thanks, Jerry. I think one of the things that's really important for people to know and understand is risk. Who is at risk for suicide? What are their indicators or their marker? And Matt, a question for you. Are there higher rates of suicide or suicide attempts among any particular demographic group or profession? And are there particular risk factors for suicide?
Absolutely. And we know that suicide rates, unfortunately, have gone up by about 35% between 1999 and 2018. So unfortunately, we know that amongst all demographics, suicide rates have increased, but in particular, older people. Older people seem to have the highest suicide rates, and there's multiple reasons behind this. Loss is a big thing. Individuals that have experienced loss are at higher risk. So, if you've lost a spouse and you're experiencing depression, increases your suicide rate significantly. A loss of freedom and control over your own life, a fear that you may not be able to live independently anymore, may cause individuals to feel suicidal. And of course, older people have chronic health conditions, which may contribute to this as well. So older people, we really need to keep an eye out for them. Men have a higher risk factor than other people. So we do know that women tend to have more suicide attempts. Men have more completion of suicide. So men as well. Single people have a higher risk factor than those involved in relationships. We know that social connections are very, very important for personal resiliency and how people deal with problems and depression. So single people as well, and lastly, military personnel and younger people seem to have higher suicide rates. First responders tend to have higher suicide rates than the general population. And we think that this is related to the kind of chronic exposures to traumatic events that military personnel and first responders have. We do know, and I wanted to touch base on the younger people as well. We really need to keep an eye out for our young people, especially now in the age of social media. The online bullying that happens is something new to me. I'm not from the age too much where social media was an issue growing up, but now we really have to keep an eye out for our kids in the online bullying.
Yeah, thank you for all that information. All good to know. Sharon, we talk about social media and a lot of people are talking about suicide. Does talking about it put ideas into people's heads?
I think that's a really common question. But what we find is when somebody is feeling so down and depressed, feeling hopeless, feeling helpless, all they're focused on is their pain, that idea is already up there in their head. And what talking about it does is validates that someone's listening, that someone hears and acknowledges their pain. When we're on the crisis line, we always ask. I'm hearing someone who's telling me they're feeling so low, they may not see purpose in life. So the natural question becomes, I hear your pain. Are you thinking about suicide? That gives permission for the individual to start talking, and that really is the first step in being able to get some help.
That's great. Sherry, your family has experienced significant and tragic loss, including extended family members. I know a lot of people seek you out for help and information as a resource as you've become a great advocate and voice for those who are really struggling. What do you feel about this conversation and how do you see us being able to mitigate some of the risk factors?
I guess our loss was very significant. We lost our only son. My daughter lost her only brother. My granddaughters lost their only uncle. So for us, we try to help other people when we hear them talk. We talk about it a lot so people know that in our home they can talk about it, whatever the problems are. They can bring them to us and we'll try to help them. This year's been a little harder. KJ's father took his life in January. I believe between loneliness and just missing his son so very much that he just couldn't be with us anymore. But he did help us with the race. He helped us get sponsors. So I guess I would just tell people that don't be afraid to talk about it. Talk about it whenever you need to. If you feel that you know someone that may be at risk, speak to them, talk to them, let them know it's okay to talk about it.
Thank you for that. Jerry, we've talked a little bit already about some of these highest risk populations, and you've highlighted some of the things that we're doing. Anything further to add about what Summit County is focusing on some of these high risk populations?
Sure, Tracy, I'd like to talk about two different populations. I think child and adolescent and some of the things that are being done throughout the ADM system to address those, and also middle-aged men, because as Matt mentioned, middle-aged men tend to be a higher risk factor for suicide. With the child and adolescent, I mentioned earlier that we've been participants in the grant that Children's Hospitals received in order to sort of do a strategic plan and some interventions around youth suicide and youth suicide prevention. But on top of those issues and those initiatives, we are also have some pieces that are in place in the community. Our crisis text line is one of those initiatives where a young person can call the crisis text line if they're having difficulties. It's a little bit different than going to an adult and talking to an adult, but these are they're staffed by trained counselors who have the ability that if there's a a sense that there's a certain level of risk that they can have an intervention done. But it gives people a comfortable area to be able to talk about what's going on in their lives. And that's really well used by our young people who don't always want to talk one-on-one about these things. So it gives them sort of a non-threatening approach. We have a lot of school-based mental health services. Greenleaf Family Center focuses in all the schools in Summit County on suicide prevention and identifying risk factors for suicide, and also giving young people the tools to go to who to go to when they notice that one of their classmates may be struggling. We have, through all of the ADM system, over $3 million in prevention services. And those prevention services really address risk factors, but they also help to build preventive factors so that individuals have the tools that they need to be able to be resilient, problem solve, deal with anxiety, all of those kinds of things that need to happen. You know, we did a youth risk behavior survey for 19,000 kids in Summit County. And one of the things that we identified in this was that the Lgbtq experience was troubling. One, the self-report of people who identified as LGBTQ was that they had experienced 2 to 3 times more likelihood than their peers to say that they felt unsafe at going to or coming home from school in the past 10 days, that they were physically hurt on purpose by someone they were dating, were forced to do sexual things that they didn't want to do, were bullied in school, away from school, and electronically, but they purposely hurt themselves and felt so sad that they stopped normal activities and seriously considered suicide and attempted suicide at a higher rate than some of their peers. And so while there's a higher risk among young people, there's also a higher risk among subpopulations of these younger people. And so a lot of the discussion and a lot of the planning is going to be on how can we support those individuals so that they don't feel so alone and that they feel the support that they need. I'd like to also talk about one of the initiatives that we're doing to address and reach out to middle-aged men. We have an initiative called Man Therapy, and this was introduced in our community about 3 or 4 years ago. Working age men, probably between the ages of 25 and 54 years old, account for the largest number of suicide deaths in the United States. The goal of Man Therapy is to show these working age men that talking about their problems, getting help and fixing themselves is masculine. So if you go to the Man Therapy website, just mantherapy.org, if you Google it, it uses irreverent humor, male humor sometimes you could say, but really sort of pokes fun at help in such a way that it's entertaining while at the same time educational. And it really allows individuals who may be suffering from some level of emotional stress to take a self-check and identify whether there may be some risk factors for them that maybe they need some assistance. The campaign's strength is its innovative and humorous approach through a fictional therapist named Dr. Rich Mahogany, who's a no-nonsense man's man that lets men know honest talk about life's problems is how they will start to solve their problems. And so as we reach out to those populations and hopefully get them individuals to identify when they're struggling, we can also then hopefully soften them up for the kind of assistance that will be helpful to them.
Jerry, we appreciate those thoughts and the leadership and the service of the ADM board to really target some of these special populations of people. It's great to be casting a broad net. We need to do that as well, but it's really good to know that. So we appreciate all of the work that's being done in the community on behalf of the ADM board. Matt, you've talked about safety forces a little bit, and that's clearly another subpopulation here. What really happens with training to prevent suicide and help those in need with our safety forces?
So Akron Fire Department, in order to be a member of the fire department, you also have to be a paramedic. And the initial part of our training is how to deal with psychiatric emergencies. So all of our paramedics, so everybody on Akron Fire Department has received training on how to deal with people experiencing mental crises and psychiatric emergencies. Our current paramedics get approximately 4 hours a year of ongoing continuing education for our paramedics as well in dealing with mental illnesses and psychiatric emergencies. As you know, police officers are able to pink slip individuals that are imminent risk to themselves. And many of our paramedics, firefighters, and police officers have the CIT training, which has been going on. I believe it's going on this week, actually. So this is a fantastic program that's offered to the police officers and fire department personnel in the city of Akron. Recently, Akron Fire Department put together the REACH program. And REACH is basically community paramedicine. The fire department has kind of historically lived in its own little bubble in some ways, but we're reaching out now with the Community Paramedicine Program and the REACH program, which stands for Resources, Education, Advocacy for Community Health. So this allows our paramedics to work with community resources and organizations, social service agencies, to deal with people who might need additional help. So if we go out on a call and we come across somebody who might need further mental health evaluations, or maybe some home assistance, so that we have direct communication with the social service resources in our community. So we're one of very few departments across the state that have this program. So and we're real proud of it.
It's really great to know. So we've heard about risk factors, we've heard about special populations that need some attention. But quite generally, Sharon, a question for you. What should we do if we think a friend or a loved one is suicidal?
When someone is feeling suicidal, we often find that they have what we call tunnel vision. All they can focus on is that pain, that psychological pain, and low self-worth, everything that goes with that. So much so that they really can't see light at the end of the tunnel. So the first thing I tell people is, we need to shine our light on them. Another very easy thing to do is to memorize our crisis hotline and make sure that everyone has it. 330-434-9144 here in Summit County. You can offer to sit down with your friend, loved one, whoever it might be, and make that call. But make sure you give them the number or the text line that Jerry had referred to. Also though, there's an important time to know when we really need to seek help. If ever you feel someone is in immediate danger, they're suicidal, they have a plan, they're not willing to seek help, the reality is, it's time to call 911 if they're not willing themselves to go to a hospital or the emergency services. We're also very resource rich here in Summit County. When someone is suicidal, our goal is to make them safe today and then steer them to the proper help, the ongoing help that they might need. Those resources are there. We have Portage Path Mental Health Center. We have many good agencies in Summit County where people can get the help they need so that they can deal with all of the issues that might be causing them to feel suicidal.
Sometimes people really are very reluctant to take a step to do that, and as I've already mentioned, Sherry, I know from working with you and alongside you in some of these initiatives, a lot of people do reach out to you in crisis. They view you as a resource now. What else can you add to what Sharon's laid out? What else do you tell people who really come to you for some help?
The first thing, of course, is I also have that number memorized now. I do get calls. And our granddaughter has experienced some depression, and Portage Path has helped her with that. I always tell people, think about your family. Choose life. Like Sharon said, I have found out through a friend that her son attempted suicide. She put us together in a room to discuss this, to figure it out. And what he told me was that not once was he thinking of his family or his friends. All he was thinking about was getting rid of the pain. So I would tell people, think about your family, think about your friends, think about whoever you can until you call that hotline, until you get some real help, because you're worth it.
That's great.
May I chime in again on that?
Sure.
What I have found too, when we're talking to people who are suicidal, most of them don't really want to die. It's that they want that pain to end. And as we're talking and processing and trying to steer to help, I'm also listening for cues of what's important in their life. Is it that family? Yeah, they haven't been thinking about that family right now because they're just feeling so much pain. But let's try to reach through that pain and find what it is that really is worth living for. Because there's always something there, always.
Jerry, often fear and stigma prevent people from seeking help at all different levels. How can we reduce this in conversations with someone who may be struggling?
I don't think that we can underestimate the power of just a caring contact with somebody, sitting down with somebody who may be struggling and asking them and talking to them. As Sharon said, you know, are you thinking about hurting yourself? Have you considered suicide? Is that something that's even crossed your mind, even in a flighting way? Because we need to understand that if that's the depth of how you feel about the circumstances that you're in, that there's probably something that we can do to get you help. But it's really important to have that difficult conversation. You know, just this week I had this conversation with somebody, and you know, it's an awkward conversation to get into, but once you start the conversation, it's a little bit easier to fold in the hopefulness and to fold in the reasons why it's important for that person to keep on trying and keep on living and to keep on dealing with whatever the issues are so that they can live a meaningful life, and that the people that love them and care about them don't experience a significant loss. And I think that's really important. You know, as we look at our prevention services and some of the groundwork we lay for folks, we call them protective factors. Our prevention services that we offer throughout the community look at things like, do you have a supportive adult? 81% of middle school and high school students say that they have a supportive adult in their lives. And our goal is to get everybody to say that they have that. Having a trusted friend, 90% of people report that they have this. And, you know, again, this is important too, because it's people that are in isolation, people that don't get a chance to talk and work through those feelings where they feel like they're trapped in this sense that it's really not true, that there are people who care about you that will help you through this. Physical activity is important. You know, we're all going through COVID and the isolation, and that physical activity is really helpful to help people to feel better. Sports teams and extracurricular activities are also important as protective factors because, again, it builds in the social support. It also gives you an opportunity to seek out mentorship from a caring adult. Seeking help. You know, one of the things that we've seen is that we've seen stigma reduced in the sense that more people are seeking help, professional help for their problems. We did the Youth Risk Behavior Survey in 2013, and in 2018, when we did it again 5 years later, we saw a higher number of people who are taking advantage of those help resources. We see a higher percentage of people who are struggling, but at the same time, if we're getting more people into treatment, more people getting help, then I think that's really positive. And then something that we can all relate to is getting enough sleep. You know, if we get enough sleep, it helps us to deal with the stressors that we face every day. And, you know, some of these things seem to be very simple things, but if you add them all together, they make a significant impact. It's helpful if you also know the 5 signs of emotional suffering. You know, our Change Direction initiative is really about how to recognize those 5 signs. Personality change. Are people that you're around, do you notice a significant change in their behavior, their personality? Do they seem more agitated than usual? They seem uncharacteristically angry or anxious or agitated or moody. And of course, going through what we're going through, we're all sort of sharing these experiences too. Being withdrawn, you know, people need to stay in connection with other people. So if you see that they're withdrawn, that's a sign. Poor self-care, you know, people that aren't combing their hair or not shaving, you know, just not changing their clothes, those kinds of things are very important to notice. And a sense of hopelessness, if people make hopeless statements, those are some signs that people may be suffering. And that's a good opportunity for you to sort of to work with them and try to process what's going on in their lives right now and how can you as a friend be helpful to them. Learning the QPR program and taking advantage of opportunities for that training. Use the ADM website to obtain information about where to refer anybody who needs help. Question, persuade, and respond. It's really about very simple ways to identify when somebody's struggling, talking to them about getting help, and also helping them to identify help resources. And then finally, if you go to the ADM board website, you can see stories of hope. You know, people who've been through their darkest days, who've come out the other side and can talk about what their lives are like now. Because when we look at people who are struggling, sometimes those issues are momentarily, they may seem as though they're sort of caught in a morass, but there is hope. And you know, treatment works and people recover, and you know, we are blessed in the system to have such a wide array of competent, caring clinicians and individuals who can provide the type of care that folks need. And so having the opportunity to just reach out and connect with those services would be something that would be helpful.
That's great, Jerry. Quickly, interestingly, we also on our Portage Path website do try to share success stories from our clients and people who have made it over the hump from their darkest days. It's very powerful for people to be sharing their stories, and we always try to get those up on the websites as well. We are fortunate to be monitoring our questions in our comment section in real time here. And we have a question that before we leave this part of the topic, I'd like all of you to consider maybe weighing in on this. It's from a person named Nick H. And his question is, if your child is bullied at school, how much should a parent get involved without risking further embarrassment and isolation from peers? And I'm confident that this question is asked with someone who's concerned about the safety of this child at school. Can we get a thought from any of you really about that?
I'll start.
Please.
Bullying is such a problem for children. And it doesn't just stop at school, it's on social media and everything else now. I would encourage a parent to get involved. I would encourage a parent to go sit down with the teacher or with the principal or whoever it is at school to make sure the school is aware of this and seeking the resources to stop it. I would also encourage the parent to get some help for their child because it's a horrible, horrible thing to be bullied.
I would agree. I think that, you know, this is not a new thing, and schools are dealing with this on an everyday basis, and so putting the schools in a position that they need to address it, I think, is important. They know that you know, how they deal with it and how they address it can increase the risk for children, and I think that they've been taught and they've been trained on how to address these kinds of issues in such a way as to minimize the risk to kids. But I think that, you know, being able to give them an opportunity to address it would be much more important than to sit back and say, well, maybe things would be worse. It's really giving them an opportunity to maybe address the situation.
I agree. Matt?
Yeah, so I have a 16-and-a-half-year-old daughter, so I certainly have witnessed firsthand, you know, online bullying, online stress that, you know, kids are getting and things. So I can certainly relate to that question. As a parent, I think we can just provide the unconditional love and support of our kids. And I think that getting involved with them, it's a balancing act. You know, you certainly don't want your, you know, to be involved in every aspect of your kid's life, and it's certainly as teenagers, you know, kids have to, you know, work through a lot of these issues that they have. But I think, you know, providing that support and encouraging counseling and absolutely chronic ongoing problems, I think parents need to get involved and try to intervene as much as they can. I also feel that, you know, the extracurricular activities that kids are involved with, whether it's sports or clubs, so that you have these multiple social interactions that your kids have. So, you know, maybe if they're having problems with one group of friends or a group of individuals, they have multiple other resources to fall back on with their interactions. So, you know, sports and social groups and clubs, I think, are really, really crucial now for kids.
Sherry, do you have a thought?
Well, our family has never experienced any type of bullying that I'm aware of. So all I have is just friends that have had this happen. I believe that teachers and the principals and superintendents need to take this very seriously. I've heard of 10-year-olds that took their life because of bullying, and that's just unacceptable. I would say to get as involved as you possibly can to save your own child.
I would agree with your thought. Absolutely a very good message. One of the things that we talk about is are there any real measures and steps that we can take in a very mechanical, hands-on sense? And Matt, I have a question for you. Does removing guns and knives from a house of a suicidal person really reduce the risk of their suicide?
Yes, it does. It absolutely does. And I know that there's a lot of strong feelings out there about firearms. But we know that many people who die by suicide act impulsively in moments of panic and despair. And easy access to lethal means has been shown to increase suicide risk. We know that through research. I believe Harvard did a large study on this, and individuals with these easy access to firearms and lethal means are at a higher risk than other people. So I would absolutely say that removing lethal means, firearms, from individuals that you may feel are at risk for suicide, and based on all of the signs and symptoms, I think is absolutely crucial. There's actually a website, I looked up, it's meansmatter.com. We've been looking at why people die by suicide. And I think that's something that we overlook a lot of times, and I believe this website reaffirms this, is not just why people die by suicide, but how they die by suicide. And 21,000 individuals take their lives per year, approximately, in the United States by firearms. It's by far the leading cause of suicide, means of suicide. So absolutely, I think it's crucial to remove firearms from individuals.
A really simple and basic question. How would someone maybe go about doing that? Or if they need help with that? Or what would our safety forces advise people to do about removing a firearm?
I think if you do have reasons to believe that somebody is at imminent risk of hurting themselves, that emergency services needs to get involved. Absolutely. I think you have to have an open, honest communication with these individuals. And I think by showing genuine concern and unconditional support for them, I think that you will have success with talking to that individual and convincing them that removing firearms from them temporarily until they get through their crisis and until they get some help, I think that you'll have success with that.
Sharon, do you have some thoughts with this?
Yeah, I was going to say, I see that on the hotline, or I've experienced that on the hotline sometimes, but we're talking about, feelings of suicide, and yes, they have a plan, and yes, they have a weapon. I'm on high alert that most people calling truly want help, and if they're holding a weapon, the first step is, can you put that weapon down? Yes, I put the weapon down. And then the next step is there someone who can take that weapon away? And often there is. And if there's not, yes, we might need to call for emergency services to get some help. But most people, again, they don't want to die. They want that pain to stop. And if we can help stop it, we've really succeeded.
I just want to throw in one other statistic that I saw here. If we can prevent somebody from using firearms in that impulsive moment, if they can get past that, we see that 90% of those people do not go on to die by suicide. Mm-hmm. So if we can get past that initial moment of just crisis, is critical.
That's a very powerful number, and thank you for adding that. We're very deeply appreciative that we have such resources, great resources in Summit County. The hotline being one of them, and Sharon, you've done years of work on that, funded by the ADM board. One of the things, though, that sometimes gets in the way of people reaching out for help, unfortunately, is either a lack of insurance, or they think they need a lot of financial means, or won't be able to pay for services, cost is prohibitive, etc. We're very fortunate in this county, and Jerry, I'd like you to really help all of the viewers and everybody who's watching this today understand how we help in this county.
Summit County ADM Board is supported largely by a local property tax levy that allows us to provide services through our agencies irrespective of your ability to pay. So if you're struggling, if you have difficulties, we can help you to get services, and not being able to pay should not be a barrier. We also can help people get connected to insurance, and most of our agencies will enroll people in Medicaid if that person doesn't qualify for insurance or doesn't have insurance. And our crisis service is offered at the ADM Crisis Center that Portage Path and Oriana House operate. Any services that are received there that are crisis related are not subject to fees. So we really want to make sure that people understand that your ability to pay for your services or fear of having a big bill afterwards is not a reason for you not to receive services. So we feel very blessed and very lucky that our taxpayers have felt that this is important enough to support our behavioral health services that we can take away that barrier from people.
That's great. It's really critical to what we do. Sharon, would you like to talk a little bit more maybe about the hotline and how that's staffed with volunteers a little bit?
Well, first I would say that the hotline could always use more volunteers.
Absolutely.
So feel free to reach out. As a volunteer, I generally serve 1 4-hour shift a week. Even though I had years of experience in social work, when I retired and explored being back on the hotline, I went back through the crisis intervention training. That is wonderful training. It's very worthwhile. It opened my eyes so much more. I would add that most of the people that call the hotline are just people like you and I that are experiencing some sort of crisis and need someone to listen, and that's what we're there for, to listen, to explore what's going on, to steer to resources if needed. And then yes, there are those callers that call in because they truly are suicidal, and those are the ones that, again, I think just need the most help and attention that we can give.
Great. Suicide is such a tragic and very significant event in many people's lives. We are, again, fortunate to have some resources locally that we can steer people to when they have lost someone to suicide. And Sharon, I'm going to come back to you and have you talk about that great group and some other things maybe in the community.
Sure. And first, I guess I'd like to say just a little bit about grief. As humans, we all experience loss. We all know the pain of losing someone and of grieving, and grief hurts. But what I have seen and experienced, and from talking with suicide survivors, loss from suicide, it just adds layers to that grief. It can be like a heavy chain around your neck. And so survivors, someone who has lost someone to suicide, really need the extra help and the extra support, and thankfully it is there. I know that many people who have lost a loved one to suicide say that just talking to others who have experienced the same thing can really help so very, very much. So here in Summit County, and I think many counties around the state and nation, we have survivors group. Normally we meet the 2nd and 4th Tuesday of every month here at Portage Path at 6:30. However, we have not been meeting because of COVID. Stay tuned though, I'm sure we will be meeting again in the future, and just a call to the hotline or to Portage Path and give you information about that. There are other resources too. If you just go online and Google suicide survivors or lost to suicide, you will find so much information. There are online groups. There's a wealth of information online. But also, there are times where you may need to turn to some professional help. Some people, talking to family and friends, that's important, or to their minister might be important, but it's perfectly acceptable and right to seek counseling and therapy to help you work through this horrible loss, because that's exactly what it is. It's a horrible, horrible loss.
We have another question that's come through in our comments section, and this question is from Jess. And she asks, if someone wants to volunteer for the hotline, how would they do that? And that's another question for Sharon.
Call the hotline, we'll get you in touch with the supervisor there, and they will take all your information, do an interview with you, and if you're both feeling, yes, let's move forward, again, they'll schedule you with a group for training.
And that number is?
The hotline number is 330-43, I'm sorry, I'm gone out of my mind here, 434-9144. Thank you, Jerry. I know that number, just.
There's also, on the Portage Path website, there's also some information about how to volunteer for the hotline. So both of those resources are available. I guess I have a question for the group. Any other thoughts of any of the conversation, discussion that we've had so far? Would anybody like to add anything at this point before we get to some wrap-up comments? Jerry?
I would just like to encourage anybody who has an interest in addressing suicide, whether they've been affected by it personally or that they just care enough to learn more about it. I think as much as we can, you can get involved in the Suicide Prevention Coalition. The ADM board does organize that, but it's open to anybody who wants to participate. The other thing that I would say is that if you have I forgot, completely lost my train of thought. It'll come back. It'll come back to me. It'll come back.
All right, Matt, you want to jump in?
Sure, yeah. I just want to say to anybody that's listening out there, addiction, loss, grief, depression, despair, loneliness does not discriminate. These are emotions that, as human beings, we're all going to experience. And coming from a first responder, we have to get beyond the stigma of reaching out for help. One thing that we've noticed with our police and firefighters and all of our first responders is that there is a stigma that continues to exist, that reaching out for help is a sign of weakness. Well, I can tell you firsthand, it is not a sign of weakness, it is a sign of strength. So if you're suffering, if you're experiencing suicidal thoughts, please reach out. There's tons of resources out there for people to reach, and it's certainly not a sign of weakness. And firefighters and police officers can reach out and get help, which we do. You know, we are humans like everybody else, and our folks need some additional help sometimes as well. So, you know, if we can do it, everybody can do it. So please reach out for help if you need it.
Jerry, you'd like to finish your thought?
Yes, I do remember what I was going to say. If you are interested in QPR training, that training is available, and we generally have classes, several classes. We like to do as much as we can, so if there's enough of an interest, we'll go ahead and form a class. I think classes are limited to about 20 individuals, and classes last no longer than 2 hours, but it does give you the tools that you need in order to identify and help somebody who may be struggling.
Okay, we do have one other question that has come our way, and this one is about the impact that suicide, or actually attempted suicide, has on family and friends. It's an interesting question. Folks living with that trauma of a loved one who has attempted, and I'd like to get some thoughts maybe from any of you about what we can do to support those folks.
I will speak to that. Oftentimes what we see happen is that the family is extremely traumatized when a loved one makes a suicide attempt. It may be that the individual who attempted was giving off some signs. It may be that they weren't giving off some signs. The family may have known that, yes, this person is troubled and struggling, but oh my gosh, we never thought that they would attempt suicide. So the family is in a state of shock as well, and wondering, how did we miss this? Just as they wonder that when someone does kill themselves, complete suicide. Or how did we miss this? What should I have done? There's all the what ifs that can really weigh upon a family. So sometimes as the family is struggling to get help for their loved one who just attempted suicide, the family needs to step back and get some help for themselves too. Surround themselves with support. Know that help is out there. Call the crisis hotline if that is what's needed, but don't just ignore all the feelings that you're experiencing yourself and think they'll go away, because they don't. They don't.
Matt?
I think of the analogy of when you're in the airplane, you're flying, and the cabin loses pressure, and the mask falls down, and they always tell you to put the mask on yourself before you put it on the person sitting next to you, because you have to take care of yourself in these situations in order to help someone else. So a lot of times these situations may be occurring for multiple reasons, but I would suggest keep talking, keep providing that support, be involved with that individual. Again, bringing up thoughts of suicide is not going to cause somebody to think about suicide. So be open. Many times people who are experiencing suicidal thoughts are also struggling with addiction as well. And sometimes addiction can run in families. So again, if you're struggling with addiction and you have a family member who's also struggling with addiction, get help for yourself as well, because you need to help yourself before you can help others.
And obviously Portage Path provides a great resource for that in the community with many of the other ADM agencies that are here. Any other thoughts before we ask Sherry for some final thoughts on our time together here? Have we missed much? Great group of people. Sherry, you know how much we appreciate you at Portage Path and all that you bring, and we view you and we know you're a brave and courageous woman, as well as a tremendous voice for suicide awareness and prevention. What are your final thoughts on today's program?
Well, I don't consider myself brave or courageous.
We won't argue about that. We're just going to go right on.
My faith has given me access to things I didn't think I could do. I don't speak publicly. Anybody that knows me personally knows that I don't like to be in the forefront of anything, but the Lord has told me to use this to help any other family that may be going through this that would like to talk to us. They can also contact Portage Path. They can get in contact with us, or somebody at risk, to know that this pain is not for a minute. This is for the rest of our lives.
Yes. Okay. Well, I'd like to thank everyone who's here, all of you who joined us, and I know that everybody who has watched and been able to view all of this great information today must be very appreciative. I think we've hit the high points. Hopefully we have given people some very useful information about prevention and awareness of suicide. It should be heartwarming to our community to know that we have folks from the ADM board we are on it. We are doing everything that we can do. We're always looking to improve that. People can get involved. We found out ways to do that, how we can help at all different points of this. So I thank you all for your participation today. I will speak in appreciation for the community for everything that everyone here is doing. And Alan, that includes you as well, sponsoring us and supporting our work and helping us to continue on. So thank you all, and appreciate it, and have a good day.